Hi, I'm Dr. Galit Talmor.
And I'm Dr. Rafi Romano.
And the subject we're going to address is space dentition. We would like to share with you several cases in which we decide to resolve the case in different aspects.
Either orthodontically, as of course some of you would choose to close spaces,
or prosthodontically, or a combination between the two of them.
And I think we will surprise you in some cases where the obvious solution will be orthodontics or prosthodontics, and we decided, because of the discussion between the two of us, to choose something which was very creative. We hope you will enjoy it. So the next case came to me when she was very young. She has hereditary missing teeth and peg-shaped lateral, and I'm now treating her brother. And we had to decide how much spaces we are going to close, where to leave space for restoration, and all this was discussed. I sent the patient, even that she was only 11 years old, I sent her to Galit for pre-consideration to see how much space she needs from my orthodontic treatment to leave her for future restoration. And this is very important to do all this discussion, which I do even before I talk with patients about appliances, about prices, about time. We do a team consideration. Sometimes we add to this discussion a periodontist, because as you can see, she has a very typical gum line, a very typical width. You know, there are thin keratinized tissue and she has a very thick keratinized tissue. So this is something that should be considered for future restoration. So we did her orthodontic treatment after we got to the agreement what we should do. Then she got to the final position of the teeth. As you can see here, she has one missing lower incisor, which we close very nicely by paralleling the remaining three incisors in a nice way. The midline pass in the middle of the one of the incisors. The upper midline is well aligned. The gum line of the front teeth is according to aesthetic rules. As you can see, we also upright the roots of the two centrals. They are now located in a good situation for future restoration. We have here asymmetrical between the two laterals, which I will let Galit to complete the work. Occlusion is very stable. Patient has permanent retention, upper and lower, and then I refer her to Galit for future for the restoration.
So actually we have here a complementary, let's say, prosthodontic procedure which was pre-planned. I mean, this patient knew all along that when she finished your ortho treatment, which was done very nicely, she will go through an ortho treatment. And why is that? This is because she has a very shy smile, and she was asking to improve her smile in terms of the gap between the teeth and the shape of the teeth. And when we examine such a smile, we can see that what we need to resolve is not only the gap between the teeth, but also the form of the teeth. The reason for the gaps between the teeth, one of the reasons, not only because of the peg-shaped laterals, is the shape, the form of the teeth. As you know, we have three kinds of form. There's the triangular, the ovoid, and the squarish. And this one, in this case, she has an ovoid shape. The ovoid shape should be changed to a squarish one, and this is how we're going to resolve the case. This is actually the point of this case. And we want to examine this kind of correction, and we do so by a wax-up and a mock-up. When we examine the mock-up, we can see that although we are a little bit on the broader aspect of the ratio between the length and the width of the teeth, Although we are on the 80%, not the 75%, maybe even the 85%, these proportions are quite acceptable. I mean, they're quite reasonable, and we can go ahead. We have a green light with the side of the patient to go ahead with the treatment. So in terms of macro aesthetics, we know that we're okay. But what about the macro aesthetics? We need to consider not only the teeth, the harmony between the teeth, but also the frame. We need to consider the smile, the face. How can we know that this patient is going to like the result? How can we know that this kind of change of proportion between the teeth is going to be suitable for the shape of the face? How can we know that she's going to be pleased with the end result? In order to do so, we use the Visage Smile software, which enabled us as clinicians to predict the degree of satisfaction of the patient with the end result. What the software actually does is take under consideration not only the shape of the teeth, the shape of the face, the guidelines of the smile, but also the personality of the patient. What we do is give the patient a questionnaire according to which we can have some kind of a hint about this patient personality. The software then combines between the personality of the patient, the face size, the face shape, and the size of the teeth, and provides us, the clinicians, with kind of recommendation about the end result, about the end shape of the teeth. This recommendation is being sent to the technician, according to which he actually creates the wax-up, and we examine this wax-up in the mouth in terms of mock-up, as you can see here in the middle picture, and then we have a green light from the side of the patient, and we can go ahead with the treatment. What we actually did here is directly restore with composite resin whatever there is to direct restore, which means the centrals according to the wax-up, the premature wax-up, and according to the silicone index. Guided by this silicone index, I created a more squarish form for the two centrals. Then I decided to restore the number 22 again in a direct manner, as you can see. Only then I decided to restore number 12. Now we should see that number 12 is a peg-shaped lateral. Of course, I could also resolve this tooth by restoring it directly with composite resin. But for me, the easiest way and the fastest way was taking the impression of the unprepared teeth, of the unprepared tooth number 12, and sending it to the technician in order for him to send an Emax veneer, which in the next appointment I only cemented. So it was a kind of a straightforward resolution, which we can see created a very nice harmony, not only between the teeth, but also between the teeth and the gingiva. It is very important in such cases to have this kind of end result, which means you create not only a correct proportion between all teeth, but also a correct support of the papilla between these teeth.
I think it is important and I know the family of this patient for many years, and I think that when we speak about high-level dentistry and on high-level aesthetics, we have to remember that in order to have the patient acceptance, everything should be really clear to the patient. So if we use discussion, simulation tools, visual tools, we can actually prepare the patient to the long process of the orthodontics, then the prosthodontics, then later on the patient came to me to do fixed retainer, and we keep the recall of the patient for many years. And if we don't do it, and most of my colleagues and her colleagues are working in a very isolated environment. They get the patient after orthodontic treatment, now they have to start rebuilding the confidence, because patient is not happy. Patient dream from the beginning was that after orthodontic treatment everything will look perfect. And sometimes in order to facilitate the work of the prosthodontist, I finish the case in a non-perfect position. I can place the tooth a little bit palatal in order to enable Galit to build it in a non-invasive way. So she will not need to prepare a lot. And this discussion should be made not only between me and her, but also with the patient. They need to understand, and then they help us to achieve this beautiful result. See you in our next series of videos in our YouTube channel. Bye bye.
Bye.